Hi, do you know what is the world's most dangerous thing to gulp? Let us see. Well, it's a button battery, and today we are going to talk about endoscopic removal of one. Once we do an X-ray of a button battery, it has a halo and compared to a coin which is completely opaque. Why is it so harmful? Because it gets impacted into the esophagus by releasing the alkali. These are some tips and tricks of removal, and this is the endoscopy. You can see that in the food pipe, the button battery has accidentally lost, the alkali has leaked from the battery and has started eroding the esophageal mucosa. What we have to do is we have to pour copious amounts of irrigation of water or normal saline, dislodge the battery very gently, push it into the stomach very gently, and then hold it with the help of broth net. Do not attempt to catch hold of the button battery with a rat tooth because it is going to break the button battery, thereby releasing the alkali further, sticking the button battery to the mucosa. Once you are into the stomach, once the battery is in the stomach, you can deploy the roth net as there is a lot of room and then remove it very gradually. The complications of this procedure can be tracheoesophageal fistula and chest complications like mediastinitis. So, if a child ingests button battery, take him to your doctor ASAP. Notice that not everyone is so lucky. Thank you.